want to make sure people understand this. So you have two sets of people that tested. The Michigan Department of Environmental Quality. So that is like each state has its own EPA. So the Michigan Department of Environmental Quality was Michigan's EPA, basically. They were the ones that were overseeing the continual water testing in Flint. They were also the ones that caused the water crisis in the first place. This is the agency that lied to the EPA. The EPA asked, are you using corrosion control chemicals in the Flint River water? The Michigan Department of Environmental Quality said, yes, we are. They weren't. That's why the lead leached off into the water. So you had Department of Environmental Quality was sending officials to people's homes. One of the people we spoke to yesterday, a 35-year-old with 3 children, never had a health problem in her life. They switched this water. Now she's got thyroid cancer, spots on her kidney. I was clear during that interview. I don't know what caused her cancer. We're not doctors, so we can't definitively say cause and effect. I do know she didn't have problems before. So she had a Department of Environmental Quality official come in her home, let that water run for a minute, and then take the sample. You are literally flushing away the potential evidence by doing that. So that's one set of officials that came in. The other set were these Flint residents that were hired by the Department of Environmental Quality, because a lot of them were long-term unemployed, so this gave them a paycheck, like you said. They were trained by the Department of Environmental Quality. So frankly, to me, I think these residents were kind of used as useful guinea pigs to go in and tell residents to do it the wrong way. Or in some cases, we found that CORE, the officials trained by the state, they went in and tested for the residents and let the water run. So whatever way you slice it, whether it's the Department of Environmental Quality or these CORE officials, by the way, a lot of these CORE officials went into people's homes with a Department of Environmental Quality supervisor literally sitting in the car outside. Well, if you're a supervisor, why are you not going in with these officials, watching what they're doing? Is it because you know they're doing it the wrong way? It's all very inhumane, I would say.
They probably didn't come in because they knew whose houses they went into. It probably had something to do with the ethnicity. It probably had to do with your economical background, or maybe they thought they were too good to walk into our houses. Who knows? But yes, they were sitting out there. There were people that brought the young people, that dropped them off and just stayed in the cars, and the young people walking up and down the street. But most of the young people look like the people in the neighborhood. That's another problem we had. Okay, if you're testing the water in Flint, why aren't you testing the water in surrounding areas to see if it's what's going on? If our water, if the lead levels are the same as maybe in Grand Blanc, Mount Morris, Flint Township, you didn't do that. You only concentrated on certain areas in Flint. So we know that it wasn't done right. It's still not right. Where are we getting our water from now? That's my biggest question. If it's coming from Detroit, why are you still messing with the water? Why are we still using filters if the water is okay? And why did you take away the water and the filters?
And there's another thing. We were really, frankly, depressed. We canvassed all around Flint for weeks over the summer. You couldn't go one block without knocking on a door where somebody just died. And not a lot of times, not elderly people, people in their 40s, in their 50s, cancers, all these things. There's a lot of people that have died here the last few years. The official count, the official count that they've given is 12 people that died of Legionnaires. There's other reports that up to 120 people died of pneumonia and Legionnaires. And who knows? Who knows how many people maybe had health problems before the water crisis, but those health problems were accelerated, like you're saying, like your mother here, and have died. There's a lot of people that are dying off here. There's also a lot of people that are moving out of Flint if they can. It's not cheap. And a lot of people think that's kind of the overall design here, to try and push a lot of the people out of Flint, to bring in industry, to bring in, some higher tax brackets, so to speak. Before we went on air, you were talking a little bit about that you think this is all, in large part, a plan to revamp Flint?
Well, I said intimate domain was the word I used because like I said, I've been here since 1970. Since 1970, we have never had a bike lane. We had to ride bikes on the street, take our life in our own hands. But people are pretty cordial when they see a bike. But the first thing you do when you want to take over a city or make it a college town or whatever, you put bike lanes in. We have bike lanes. We have homes on South Saginaw that weren't there in the hundreds of thousands of dollars. We have homes that they put there that you can buy a house for $550 a month. Okay, where do they do that? $550 a month these days. Then they're revamping the downtown Flint area. We have Michigan State College. We have University of Michigan. We have Mott. We have other colleges that are coming in here. First thing they do when they want to get rid of the residents, they take the food. We have little grocery stores. We call them Paymore stores. They know who they are. But you take the big stores away so that we are uncomfortable, or the ones that can't get to them, we have to move closer. That means we're moving out of Flint. People that are leaving for jobs because you got rid of the jobs because you knew what you did to the water. The shops left because their parts were being corroded because of the water. We may not say much because a lot of people are afraid to open their mouths because we have to live here. Our families have worked. They bought homes. This is where they retire. The retirement money in the state of Michigan is not going to fund you to move to another state where the cost of living is higher. So we're pretty much stuck. And it shouldn't be like that. If you bought a home, you live in a place, and you could afford it, just because politicians decide that they want the money, they want it to put it in their pockets. You have the lobbyists. I'm not saying it right, but I'm ticked.
Lobbies?
Yeah, those people. You have them that want the money for themselves. They don't care about us. It's a money thing. It's always been about money. Like they want to, down by Hurley Hospital, they got rid of houses so the doctors could have places. They could have more parking. They could do all of these things. They are making Flint look like something different. It does not look like the Flint I know.
And let me ask you, what we found dozens of homes that this testing was done essentially illegally. I mean, if you break federal regulations, that's not like a minor thing. Do you think there's any plausible way that the governor of Michigan wasn't aware what his agency was doing? Because it always seems like he just wasn't aware. Nobody told him. He was misinformed. Do you think it's possible that Governor Rick Snyder was not aware that his environmental agency was, first of all, they weren't supposed to be going into people's homes that were on this program? The official program was the Sentinel State program. These were 650 homes they chose to consistently be tested. The EPA told me and Jen that they were just supposed to drop off the test kits. They weren't supposed to be doing the testing. In what world did he not know about this? And if he didn't know about it, isn't that kind of negligence in itself?
He knew about it. He applied for the position of governor. He wasn't doing what he was supposed to do. And he knew that he only had a short time, so he didn't care. He doesn't care. He still doesn't care. What is he doing now? Before he goes out, he should do something. He should make sure that it's done right, and he should take himself to jail and lock himself in his closet.
Last question. You're a strong woman, obviously, but this probably has taken a huge toll on you. I mean, your mother in her golden years has been sick, and you have to take care of her, which is a full-time job in itself. You're having health problems. I'm sure with your nephews and your nieces and grandkids, you said?
My grandbaby passed.
Oh, okay, sorry. Mm-hmm. This is not just physically tough, but mentally, how is this taking a toll on you?
I have insomnia. I told you, I have to think about my day 24 hours. I even think of what I'm going to do in my sleep the next day. I'm used to going to sleep and sleeping, dreaming, having nice dreams. I go to sleep now and I have to worry about, okay, how much water do I need for tomorrow? How much water am I going to need for the rest of the month? What am I going to cook? Because I'm from the South. We eat home cooked Southern food. We wash greens, we wash meat, we do all those kind of things, which takes water. I can't, because of my kidneys and because of the water, I can't use stuff out of a can. I've got to get fresh or frozen. So I have to think about all these things that were just natural, came natural, and I've been in the hospital. I've been in the hospital on stress. I've had surgery since the water because of issues that I don't want to put out there. But it's not a way to live. It's inhuman. It's just, I don't know. I can't even find the words to say how I feel. And I know my family and I know friends and I know other people that live here. They feel the same way, but they're busy trying to make a living. They're busy trying to see about these babies that have been affected. They're trying to make it, and we're not. We're not happy. We're not making it. This is a worse oppression. It's not a recession. It's an oppression that people can't seem to come out of right now.